Hi guys, welcome back for Module 2. In this week's module, we will be focusing on occupation-based practice in long-term care, skilled nursing facilities. We will also be discussing barriers and challenges to using occupation-based practice. During this module, we will explore the perceptions, ideas, and incorporation of occupation-based treatment among therapists, while discussing the barriers and challenges associated with occupation-based practice. Also, we will discuss strategies to increase the use of occupation-based practice as a method of change. The process for modular activities for this week, they're the same as Module 1. I just wanted to put them up again for review reminder. So during week 1, we will read the articles attached later in the PowerPoint, participate in the discussion, post initial response by Friday of week 1, add comments to 2 peer colleagues of your choice. Please try to get some discussion going, ask questions to each other. And again, please, when you're responding to the discussion blog question, please reply all. That way everyone can view your post. Review summary post that will occur on week 2, Friday. And just again, a reminder, to receive continuing education credit, you must participate fully in each of the 4 modules. So this module will start on January 18th and run through the 22nd, which is week 1, with the initial response due on Friday the 22nd. Please post 2 responses by Wednesday, January 27th of week 2. Please listen to and watch week 1 wrap up on Friday, January 29th of week 2. Module 3 will begin on February 1st. So the challenges and barriers to occupation-based practice are often productivity demands, reimbursement, insurance, complying with the medical model of practice, and environmental constraints. Occupational therapists working within a medical model of practice, medical-based settings such as skilled nursing facilities, long-term care, often are conflicted between providing occupation-based practice and meeting the requirements of the healthcare system, which are to treat the maximum number of patients possible, make sure criteria for reimbursement is met, all while providing skilled services in an environment that often has limited space and supplies. I'm sure many of you experience those same challenges and barriers daily. So while we're going through this PowerPoint presentation, I want you guys to just think about what challenges and barriers you face that are specific to your facility. So even though we have several barriers and challenges, does evidence-based research support the use of occupation-based practice? The answer is yes. Evidence-based research fully supports the use of occupation-based practice in clinical settings. According to Rogers 2007, the evidence is clear that engagement in valued occupations may be more helpful in developing independence and motor skills than any other form of intervention. It has also been found that client-centeredness occupation-based interventions can be effective in improving and maintaining IADL performance of the elderly adults residing in skilled nursing facilities. However, research also suggests that continuing education and training for therapists is essential for the implementation of occupation-based practice. So, in regards to the healthcare reform, does it support occupation-based practice? The Patient Protection and Affordable Care Act of 2012 emphasizes patient-centeredness as both an outcome in and of itself and as a means to improve health outcomes, therefore supporting the use of occupation-based practice. When implementing occupation-based practice, it must be patient or client-centered. Also, the health reform promotes the delivery of patient-centered care. Occupational therapy's history of client-centeredness theory and practice provides an opportunity for our profession to have an active role in the healthcare reform by developing best practice that is client-centered, again, what would be considered occupation-based practice. The suggested articles for this week are listed below. The Upton, Stevens, Williams, and Sherlock-Evans article I was not able to download the abstract for. However, if you are a member of AOTA, the full article is available there. If you Google the reference, you can find bits and pieces of what the article is about. Hopefully that will be enough to answer the discussion questions. The second article, the abstract, is listed on the next slide. And lastly, the Rogers article. If you follow the link provided, that will give you access to the article whether you are a member of AOTA or not. So the discussion questions for this week's blog, the first one is, what are the greatest challenges you face while using occupation-based practice within the skilled nursing facility population? Please provide specific examples of the challenges you face in your facility. As practitioners, what tools, supports do you need in order to minimize the barriers you are facing in regards to implementing occupation-based practice? Please provide a detailed list with rationale of at least 3 supports or tools you would find helpful. Again, remember each question should have a response of approximately 1 to 2 paragraphs per question. And please post initial response by Friday. So this concludes Module 2. Module 3 will be available on February 1st. Remember to listen to the weekly wrap-up available on Friday. Here's a reference list of the that I used during this presentation. Thank you guys. See you next week.